Hello, this is Anne DeGheest, and it's Friday, August the 27th. And I have decided to change the format. There's a lot of things happened since the last video 5 weeks ago. So time is really running out, and we'll talk about that and getting vaccinated. This time I'm going to do one slightly longer video, but all of these things are intertwined. So please hang in there because there's a lot of great information that have emerged. So new format, what's the good, the bad, and the ugly that we're going to discuss? These are some of the key takeaways. On the good news is that the breakthrough cases, which is for somebody who is vaccinated when they're being infected, is around 2 to 3% risk. I know there's been a lot in the news there, but it's still, a very low cases. Pfizer got the full FDA approval. Boosters are coming. We're going to do a deep dive on what's happening with the vaccine waning over time for both the mRNA, the J&J and AstraZeneca vaccine. There has been an uptick in US vaccination, but remember, it takes 6 weeks before you get protected. Delta is so contagious. It takes 6 weeks. And unfortunately, I expect the next 2 months are going to see a continued increase of the infection rate in the US. And there's a lot of great news on the vaccine is still protecting you against severe case. So we're going to do a lot of deep dive for all the different vaccines. Lots of information will be published. On the bad news is that we're going to expand on what exactly is vaccine efficacy. And it was initially designed in the clinical trials for severe and hospitalization there. What we're discovering is that the vaccination efficacy is going down over time with infection. So we're going to go very deep on that. We're going to see what's happening in the US, where unfortunately we have 100,000 people in the US in the hospital settings right now, and especially in the Southeast area with low vaccinated case. As a result of that, we have a lot of ICUs that are full and ER long wait and nursing shortage, and should expect that with the schools reopening there. There's a data just came out showing that younger kids are more infectious. So again, hang in there, lots of good data. In the ugly, unfortunately, the Delta has totally taken over the US. In the last 9 weeks, there's been a 6 times increase in the number of people hospitalized, over 100,000 people, mostly unvaccinated. 13-time increase in the number of new COVID cases per day. We're now at 156,000. And unfortunately, an unprecedented number of hospitalized kids, and it looks like Delta is having a much bigger impact on the younger population than the original variant. So let's take a deep dive on all those issues there. And Delta is the variant in the US. It got rid of the P1, which is coming from Brazil, and the original UK variant. It is the variant in the US. And that's going to be critical because we're going to learn what happened in other countries there. So unfortunately, since I saw you, we have gone from 45,000 cases per day to 156,000. And you can see we're getting at the level of some of the November surge that we had in 2020. And unfortunately, now we've increased to 1,200 people dying per day. So unfortunately, that's not good at all. Most of the area we're going to spend some time is in the South, and unfortunately Mississippi is the leading one. And the good news is that we're having some vaccination, but still half the country, if you look at all ages, and remember all the young people cannot get vaccinated, are not vaccinated. That means there's a lot of bodies that the COVID can spread through. So the fourth wave is extremely high. You can see the red area there is the very high density, which is the number of cases per 100,000. And you're going to see in the next slide that some states are very high. The good news or the bad news, depending how you look at this, is 95% of the cases are unvaccinated patients there. And so the vaccines are working and protecting. Unfortunately, Delta is 1,000 times more infections there, so it is driving faster hospitalization. What we really worry is hospitalization. I mean, these are severe cases. People ending up in the ICU. You can see Israel and other European countries are also having a fourth wave. This is the thing we don't like to see, which is the number of serious and critical cases are now at one of the highest level there, and that's looking at the number of people are in the hospitals. That's the 100,000 numbers I mentioned earlier. So it is unfortunately a disease of the unvaccinated. And if you look at hospitalization, the vast majority of them are unvaccinated. And you can see this whole area there is where we're having the big problem there. A very interesting study done by the CDC that comparing the percent of the people who are vaccinated versus the hospitalization rate. And you can really see the correlation between the state that have a high vaccination rate and a low hospitalization rate versus some of the Southeast area there. This is the number that are staggering there. Remember, the country as a whole is 47 per 100,000, which is a 3 times increase versus when we took the last time. But look at Mississippi, Florida, and Louisiana there. These are massive numbers there and big increase there. And so that's extremely worrisome because it's a vertical curve. And this is the curve we don't like to see, that really explosion that we've seen with Delta in India and the UK there. And hopefully it goes down, but that's a bit too early there. That's only maybe a 1 week data set. So it's still pretty much on the acceleration side. And unfortunately, 3 to 4 weeks later, hospitalization goes up. And so that is clearly showing that the Delta is unfortunately infecting and affecting everybody regardless of age, because most of the people in the hospitals are younger people now, end up unfortunately in the ICU. So overall in the US, 77% of the ICUs of beds are full, but in this area there, it can be as high as 95 to 100%. In Texas, they were airlifting pediatric cases outside of Texas in certain area there because they didn't have any beds. So we need to learn from the past. So if you look what happened in India there, you had that massive spike like what we're seeing right now, and then a massive drop. And that's because when the spike exploded like that, and they did some seroprevalence in India there, 67% of the population had developed antibody. The thing spread everywhere. But then if you look at Brazil, which has a different variant, that famous gamma that's avoiding the antibodies, and you can see it's a steady heady there. Yeah, it's going down there, but it is not the type of massive rise and peak that we saw with the Delta. So in the US, we do have, like the UK had, the Delta variant, but this is what's worrisome. Again, they're like 1 month ahead of us. They had that big spike like we're experiencing right now, and then they're leveling off at a really high level. And we don't want to see that. What we want to see is that you basically go up and then you go down and you're very low level there. So to be seen, we need to observe what's going to happen there. And UK has a bit of a spark going back upwards again. So if you compare on the relative basis, so per capita, the amount of new cases versus the amount of deaths, because these are the ones we are worried about, you can see, unfortunately, in orange there is the US, which is clearly leading the pack, unfortunately. Do we know what's going on? And unfortunately, if you look at the number of tests per 1,000 people, so it's normalized, you can see that we do like 1/3 of the tests that, for example, Israel is doing. I'm not looking genomics, I'm just saying the number of tests we're doing there. So we are kind of blind, and we're doing significantly less tests than we were doing during the big surge. Why is that an issue there? Because right now we're showing a positivity rate that has gone over 10%. And remember, our objective is to be below 5%. To try to contain the spread of the virus. And more importantly, the data just came out looking at what's called prevalence. And prevalence means is that when you look at the blood analysis done by Quest and some of the big places like LabCorp, they also look at the amount of antibodies, which does include people who may be asymptomatic, who got the disease and develop antibodies. And mild to medium cases. And what it shows is that the prevalence in the US is that 20% of the population has been exposed. So it's good news, bad news. That means they have developed antibodies, and you're going to see a bit later on that those antibodies are lasting longer than people are vaccinated. So this is brand new recent news that just came out. And that means they have at least, for a good 6 to 9 months, some protection against the Delta spreading around. But it also means that a much higher percentage of what we've estimated of the population, so it's expected over 66 million Americans have been exposed to the virus, as opposed to the confirmed case, which is roughly half of that. So what's happening to vaccination? We have had an uptick, but we're very far from the top that we had over 3 million cases there. And most of the younger population is unfortunately under-vaccinated. So we've done a great job with people over the age of 65. You can see we're pretty much close to 80% of that population is protected there. But this is where the spread of the Delta is. And unfortunately, what we are learning is this Delta can create severe cases in young people in a way that seems to be worse than what it was for the original Wuhan variant. Another interesting graphic from the CDC showed that the Black population is the one that has the least amount of vaccination. And you're going to see that is tied to the Southeast area there. And then we have the Hispanic are under vaccinated, and then the white, the Asian, and the American Indians have done a great job of vaccinating their population. That's because they had initially a big outbreak. To give you an idea, if you look at the Black vaccination, which is in orange, is the ratio of the percent of people vaccinated by the percent of people in that region. And you can really see in that whole area there we have the outbreak, this is where we see there's a lower percentage of the Black population that's vaccinated versus the other demographics. If you look at the Hispanic, you can see they were initially pretty bad, but they have been catching up since February. So there has been a pretty good action there to basically vaccinate the Hispanic population. Now, the good news, despite the fact, and I'm going to spend quite a bit of time on this, the fact that you as vaccinated people may still be infected, but not necessarily very sick, the data is still very clear cut that, you know, we get somebody who is non-vaccinated, you have a 25 times protection by being vaccinated against hospitalization and against mortality there. So I think it's really important that I clarify this before we do the deep dive, so we don't get stuck in the weeds there. Vaccines do work. They protect very well for severe case and hospitalization. What you're going to see is that they're declining in their protection for the risk of being infected. So let's take a deep dive in there. Some more good news is that a data just came out from the British, from BMG, it's a British journals there, that shows that all the complications you may have heard in the press about AstraZeneca that can create blood clots and Pfizer that can create ischemic strokes. If you compare the incidence of people who are vaccinated versus people who got the virus, you can see you have a 200 times higher chance of getting blood clots from catching COVID than if you took the AstraZeneca vaccine. And as far as Pfizer, which is more in the US, you have 12 times higher chance of getting ischemic strokes from catching the virus than if you had the vaccine. So yes, we're concerned about some of these really, really low level of side effects there, but that is nothing compared to getting this nasty, nasty virus there. And remember, these are logarithmic scales. So you can see the delta here is astonishing. In red is the virus incidence of giving you this type of complication there versus in orange is AstraZeneca and in purple is Pfizer. So the vaccine are very safe compared to catching the virus. So what's the threat with Delta? And we're learning more and more, unfortunately, that this is a really nasty mutation there. It's a 10 times more contagious and in creating severe death and diseases. It increased the risk of being infected for vaccinated people. We'll do a bit of a deep dive there. It looks like it's a 3x higher chance of getting infected there. And you're going to see some data that shows that you can carry the same amount of viral load as somebody who wasn't vaccinated. But there's some good news, hang in there. Vaccines still prevent 90% of severe diseases. So masking and any type of natural protection like ventilation and all of that still is something you need to keep in mind in the environment you're in. So I'm going to share you some website, which I'll post, where you can evaluate your risk depending on your local risk. So let's kind of find out why is Delta so dangerous. The incubation period is now shorter. So it used to be from the time you get exposed to the time you start really getting high viral load and symptoms has gone from 6 days to 4 days. You also are much more infectious there. You can infect 6 to 8 people, where the original one you will infect 2 to 3 people. That's famous R0 that we talked about. And when we look at that Delta variant, it has multiple mutations. It's not just one mutation. And one of them, which is a new one, is this P681R. It has 1,000 times more virus particles in your respiratory tract. Therefore, it's very easy to spread. And that is why you have a higher chance, unfortunately, of getting infected before the antibody can kick in. So let's look at that P6184. It is on the spike. It's that little thing in here. You can see that. And they did an interesting experiment where they took that Delta and they removed just that one mutation there. And then they look at the infection rate and the contagious rate. And then it went back to the old days of the Alpha. So it is clearly that one mutation there that made this Delta so dangerous, literally spreading across the world. So another big news, which is relevant if you have children or people around you are going back to school, is that this is comparing younger children compared to teenagers. So the ratio is that the 0 to 8 years old are 1.4 times more contagious and a higher chance of spreading the virus than a teenager, which is roughly equivalent to an adult there. And this data just came out, and it's also showing to be aligned with prior data from other countries like in Denmark, Spain, and South Korea there. So there is viral load in children, even if they are asymptomatics, and they do spread the virus faster. And we all know that, as parents, that when the kids goes to school, you end up being sick within 6 weeks. So the reason why the CDC was really concerned and changed the guidelines a few weeks ago is that there was this event in Massachusetts there where they had like a 3-day activities. There was a lot of indoor events, and you can see 75% of the people got infected were vaccinated. That's when everybody started realizing that this Delta is changing a lot of the ideas that we had from the Alpha. A lot of the rules on how to protect yourself are now changing. And when they start looking at the viral load, they find out that a fully vaccinated person had the same amount of viral load in the upper respiratory in the nose area than somebody who was unvaccinated. That means they can quickly spread it after the infection. Now, there's some good news. One of the reasons why this Delta is so fast is I look at the amount of fusion activity. That means the amount of viral that's being created in a period of literally 50 minutes. This thing is like a nuclear bomb exploding inside your body there. You have this massive generation of particles. They're much more than you saw in, for example, the beta here. So that is the reason that you get infected, you get exposed, and you develop a lot of antibodies, a lot of virus particles in a very short period of time. Now, there are some good news. What they're discovering is that if you are vaccinated, over time, you make less viral load, although you have that initial surge. It also, you're going to see decline faster, so you get rid of it as the antibodies kick in. And you have a significantly lower duration of symptoms, 10 days versus 16 days, and less symptoms. So this is, so that's some good news there. Let's take a look about how Delta is also impacting vaccine effectiveness, because there's such a huge viral load in a short period of time there. It takes several days for the antibodies to kick in. And so most of the way the vaccine have been approved by the FDA is measuring hospitalization and severe case. That's really what we were worrying about. What's called the VE, the vaccine effectiveness. What we are discovering in the last months is that the effectiveness against being infected is lower than the effectiveness about ending up in the hospitals. And there's a data here from the UK that showed that the Pfizer-BioNTech vaccine after 3 to 4 months is basically dropping its protection against infection, not severity, but infection, at a pretty fast rate, and faster rate than AstraZeneca. So the efficacy at 4 to 5 months could be very similar. Let's take a look at some of the other data. These are just reports that came out this week. It shows that the Delta in the US has impacted the vaccine effectiveness from 91% when we had the prior variants to 66% as of a few weeks ago. So it is now more and more documentation showing that the Delta is able to slow down the protection against infection. There's another data that just came out from the UK called the ZOE COVID study there, and it showed that Pfizer's effectiveness against infection dropped from 88 to 74%, and AstraZeneca dropped from 77 to 67%. And you can really see that as Delta took over, there's the natural attenuation of the protection of the vaccine, and then you have the Delta that had that accelerated slowdown. So, but let's keep perspective here. We are talking from the data, there's a set multiple reports from several locations there. So Eric Topol kind of summarized this, is that, the protection may be as low as 39% against infection, but, and you may still have some symptoms, for maybe 1 or 2 weeks, but you are extremely well protected against what we really want to, which is hospitalization and severe cases that may require intubations or ICU care. And this is, again, more data. I know it's confusing there, but I just want to show you the rate that this data is really coming out, that Moderna seems to be behaving a little bit better based on the most recent data than Pfizer's in their range. And this is for infection. So you can see that in blue is the Pfizer one, and Moderna seems to be, lasting a little bit better there. But what we really care is hospitalization, and you can see all of them are still extremely effective and protective there. So Let's look at Israel. Israel was in the news, and I want to spend a little bit more time to make sure we don't get overwhelmed with the data and have the wrong conclusions there. So Israel is going for a fourth wave like we are. They're just like maybe 1 or 2 months before us. And what they start to see is that, that they had this huge rise there, and that up to half the people in the hospitals, were vaccinated. And of course, this got getting really worried about. So they have started giving the booster shot first for people over 60, and then 50, and now over 40 years old. So the whole population is probably going to get the booster shot. And the reason why they were worried, this is a few weeks old, but you can see that they were looking about when you got your second shot. So in my case, I was at the end of February there. And what it shows is that after a period of 4 months there, my protection went from 75% against infection to as low as 16%. And that's why everybody started to say, okay, we have to give a booster shot to basically rebuild the antibodies. And you're going to see there's a lot of good news on that. So hang in there. So let's look at immunization. Remember, there is the antibodies, which are these guys. And then there's the T cells, which are much more longer lasting, but not as specific there. So let's look at some of the data that just came out today, that if you were infected, remember we have shown that 20% of Americans have antibodies showing they have been infected there. They just now have shown that the natural immunity, so the antibodies you have built by having been infected, lasts longer than if you were what's called a naive vaccine. A naive vaccine means you did not get infected while you got the vaccine. And the delta is 13x. That means you have more antibodies and a better protection when you get exposed the second time there. And so more data from Moderna really showing against the Delta, they are still very effective in keeping the antibodies at 4 to 6 months. Now, the big thing is the T cells. The T cells, remember, is the general army as opposed to the target me cells, which are the antibodies. And what they're showing, which is very reassuring, is that the T cells at 7 months are still at 94% level. That means we still have this very strong overall defense. But remember, it takes several days before the T cells can kick in, which means you may still get infected and be contagious. That doesn't mean you get very sick. So again, that kind of reinforces what we're seeing with real world evidence. So breakthrough cases are people who are vaccinated who end up being infected, and they end up being tested, and then we saw a positive PCR test. It looks like the case rate is around 2 to 3%. Is the breakthrough case there. And that was based with a slightly higher ratio for people over the age of 60, just because your immune system is not as strong as the younger population there. So let's not freak out here. I mean, 2 to 3% is not a reason to just, lock yourself up and don't get out of your house. So antibodies seems to be a predictor of the vaccine protection. This just came out showing that people who were vaccinated, remember, we're not really checking your antibodies level after you get vaccinated. Well, in this one case, they did 30,000 volunteers, which part of the original Moderna trials, and they continue to evaluate them afterwards. What they discovered is 2% of these people who had the vaccine did not develop a very good level of antibodies, which somehow is a very similar number to the people with the breakthrough cases. And half of these people, got exposed but didn't get sick. So despite the fact they have low antibody, maybe the T cells were still good, they still got protected there. But it's very clear that there is a percent of the population there who did not get a good response after they got the vaccine. And since we're not testing it, we'll be blind. And the good news, that means that 98% of the people got a very strong antibody response. And the data is also for immunocompromised. Around 2.7% of the population in the US is immunocompromised. And the data came out that 44% of the people who end up being hospitalized as a breakthrough case were people immunocompromised. Again, that means that the antibody response after the vaccine because of medication or some diseases that they have, was not as strong. Again, common sense there. These are people who had cancer or HIV, who have some organ transplants and under medication that depress their immune system there. So I think that if you are immunocompromised and you've been vaccinated, it may be worthwhile to maybe figure a way to measure your antibodies. So the CDC recommended as of July 22 that population is not officially authorized to get a third dose, just because the data is very clear-cut that they're exposed and at risk. So some data here that's really interesting. This shows the viral load of people who are unvaccinated versus vaccinated, and looks to me very similar in the graphic there. So what it seems to be showing is that when you get infected, you have that huge surge that the Delta creates in the first several, 100 minutes there, and you have that same huge viral load in the nose there. Now, that doesn't mean that you're infecting more people. We don't know that. What we know is that we can measure you have more viral load in your nose. In fact, the data seems to be showing that over time, you're shedding, because the antibodies kick in, you're shedding and getting rid of the viral load. So there's less viral load after 2 to 3 days. That means that, yes, you could be contagious for 2 to 3 days after exposure there, but then very quickly your body immune system kicks in and get rid of these viruses. Another graphic of this is you can see over the time of the illness there that vaccinated people recovering faster, and they have a lower viral load, and therefore they have a lower chance of hopefully infecting other people there. This is a study that just came out from Singapore, where they measure continuously over time the amount of viral load, which is hard to do. It's not it's on the PCR, it's the quantity of viral load that they're shedding. So good news, the FDA has now provided full approval to Pfizer for everybody over the age of 16 years old. That, as you can see, is now driving a vaccination mandate across the industry, especially from employers and the DoD, the New York schools. A lot of the healthcare systems, are mandating that the healthcare workers are vaccinated. Now, just as a refresher, for 12 to 15 years old, it's still an emergency approval. And the trials is still in progress there for the younger population between 5 and 11, which they expect to get the results by the end of September. And last I heard, that means they probably won't get the vaccine available until the end of the year or beginning of next year. Pfizer, as more and more data showing a drop of effectiveness in a period of 3 months. Same thing for AstraZeneca. But the booster that they show in Israel, this is real world evidence, which is people in the hospitals there and people who are in cases. As soon as they start giving the booster here, these are the vaccinated people, you can see it leveled off and start going downward. So, at time real world evidence, it's much more powerful than hypothetical cases. Now, a lot of people have been talking about the Israeli data there to say, oh my gosh, 80% of the people in the hospital have been vaccinated. But keep in mind, 80% of the population is vaccinated. So by definition, if a very high percent of the population is vaccinated, those people will end up in a hospital there. And so if you look at the ratio and really adjust it based on the percent of the population that is vaccinated versus unvaccinated, you can see that the Pfizer vaccine is still 67% effective against severe disease. I won't spend a lot of time there because I know it's a long video today, but this was broken down by the age groups, and you can really see there's a big impact there, especially people over the age of 50 years old. Their protection is 85% and 91% for people less than 50 years old there. So what I'm trying to say is that the vaccine protects you against hospitalization severity. That is still the case. And you have to really be careful there when people say, oh my gosh, 80% of people in Israel in the hospitals are vaccinated. And that's because the vast majority of their population there is vaccinated. So you have to adjust for the ratio of those population there to really look at the efficacy of the vaccine. So Eric Topol did a very nice analysis showing that when you have that second dose there, you get that really big there. What you already see is that you get that third dose there, you get 8 to 10 times more antibodies than what you got after the second dose. And it's very clear that we do need that extra boost there because there's the weaning of the antibodies over time. And then the Delta variant is so much more contagious there. So it's been unclear if it's going to be 6 months or 8 months. Welcome to the US. The Biden administration announced it was going to be 8 months pending FDA approval. Here's the problem. All the data provided by the pharma industry is at 6 months. And all the real world evidence showed that you have a big drop in protection at 4, 5 to 6 months. So there's rumor, unconfirmed there, that the booster may be at 6 months, but all of that needs to be decided at the CDC and FDA level, but expect this to happen in probably the next 30 days. And it is very important that, you also understand that people in nursing home, the data is a bit more worrisome there, that they've shown that the efficacy in nursing home, because of the age, has dropped from 75% to 53%. So I know a lot of the nursing homes are going back into shutdown, which is a terrible thing for the elderly there, because then they're isolated, there's depression, they can't see their family and all of that. So, if you have loved ones there, you may want to be proactive on that. Lots of data coming out from New York, where up to 20% of their cases were breakthrough cases there and 15% hospitalization. Again, it all go back into how the number is being calculated there. Oops. So Moderna is great news. They did a study there. This is the study with the booster. And you can see the delta there. Look at the delta between what you had 6 months to 8 months after the second dose. You can see it dropped over time, not a lot, but maybe by a factor of 2. And then you get a third dose and bada boom, it close to, double at the minimum there. So clearly the data is not coming from both Moderna and Pfizer. I'll show you the Pfizer one, saying that the third booster is much more effective in creating antibody than the second dose, which makes sense because now your body, has a lot of antibodies to basically amplify. So their recommendation, and they even look at maybe a half dose. So you had 100 milligram, and they're even looking at maybe doing a half dose, maybe decrease some of the side effects, but that's not decided yet. Pfizer showed that they're 90% effective against Delta after the third booster. This is based on the real world evidence coming out of Israel, which was given against people around 60 years old. And you can really see that you had that problem there. And then you had the booster and boom, you had a drastic increase in the effectiveness there. So the good news is that we have controlled clinical trials and we have real world evidence that validate that booster is extremely effective in increasing antibody protection against the viral in the community. J&J just came out with their own data, and that was a big worry because we have 14 million Americans who got the J&J who felt a little bit abandoned by this whole process there. But they show that if you give a second dose in their case, so it's still a booster, but as a second dose, that they create 9 times more antibody, which seems to be aligned to some of the things that Moderna and Pfizer are seeing is a much bigger response after the booster there. So you should expect that one to be, requested in the coming months. Europe has already decided to move ahead, and they start giving across all of Europe boosters first, they use it for the elderly population, and like Israel, they start getting to younger population there. It is controversial on a worldwide basis there, because when you look at countries like South America and Africa and part of Asia there, we have such an under-vaccination of the population there that people say, hey, we should use these booster shots for vaccinating the rest of the world as opposed to the rich countries there. And of course, that's a big political hot potato. So I wanted to do a quick recap because the rules with Delta have changed. So if you remember, you get exposed, it usually goes into your nose, then starts spreading into your oral salivary area there, which is how you can basically spread the virus. And then it gets into your lungs, and then it gets systemic into your body there. So just to be clear, because there was so much confusion last year, the problem with Delta variant of COVID, it is airborne. That's the one you really worry about. And I'm going to share more data there. You worry about the tiny particle, the one that's less than 5 microns, because these are like smoking cigarette. It stays in the air for hours. It's like smoke. It floats. Most of the bigger droplets there, they literally drop within a meter. Let's say if I was 6 feet there. The problem with the Delta, it produced so many of these small particles there that somebody creates much bigger smokes than they used to have with the Wuhan. So for example, there was a study that just came out where they kind of had the students there talking and speaking and all type of different conditions there, and they literally quantified the amount of particle they were issuing there. And it is very clear that the old rules of 6 feet for 15 minutes no longer apply. I want to emphasize that it is no longer relevant because the Delta is so contagious there. And so there has been case of people got infected by going to a room after somebody else had left, but the particle like a smoke were still in the air. And there's been case reported where they got exposed for 15 seconds and they got enough of a viral load and not enough antibodies that they unfortunately got infected there. So remember, we're talking a factor of 1,000 times more viral load versus the Wuhan. So I'm going to share some of the formula you can use to calculate your risk. So we need to go back to the multi-layer of protection, which is mask, ventilation, and filtration. Trying to be outside as much as you are. And if you're inside, make sure there's good air purifier. This is what's called a Swiss cheese defense. Vaccine is just a piece of it. We are not back to the old days. In fact, I don't think we're going to go back to the old days, at least for several years. I mean, I don't think we can get to herd immunity the way these vaccines are mutating. But if you start using common sense and you use kind of different type of protection based on the environment you're in, you should be able to keep yourself safe. I think the N95 needs to come back. There's no longer shortage of the N95. You can buy them on Amazon for 80 cents to $1 a piece. Make sure that when you buy them, they have this stamp for NIOSH. And that's usually, you can see here on the mask, it's usually printed on the side. So really make sure before you buy anything that it has that stamp. I will also post a list that the CDC has shown where you can look about what to pay attention for counterfeit. A lot of the K95, which are made in China, have counterfeit, and they're really not very good in their filtration there. And there's a list there of approved product by name. So you can basically validate that just to be on the safe side. It's also fantastic if you live in California right now, because it's the best protection against the bad air we're having right now for wildfires. You may also want to get some of this COVID-19 test. And so remember, the golden standard is the LabCorp and Quest PCR test, but that takes, in the best case, 1 to 2 days to get the results. Now, a lot of people can buy these at-home tests for $20, for 2 tests there. And that it's an antigen test. It's not as accurate there, but, because it takes a little bit longer for the incubation to really be able to be detectable. So the sensitivity is not as high there. But the Binax now made by Abbott is now in shortage there because they made a decision a few months ago. This whole thing was over. They wiped out 6 million tests and laid off their employees. They're thinking we're back to the old days. And you know what happened. You also want to layer the test. So if you're going to an area there where you are concerned, get a PCR before traveling, because I think a lot of the airlines are requesting that, and there's a lot of services allowing you that. Do a rapid testing night the day before you leave and after you arrive, and then use common sense there. Remember, testing is not a substitute for vaccination. Vaccination is your best defense. The other thing, in case, unfortunately, you are unlucky, or somebody is unlucky there, you need to ask for monoclonal antibodies there. It's free and paid by the government. It's around $2,100 paid by the government right now. And only 30% of people who could benefit from it are using it. The most famous one is called Regeneron, and it's a cocktail of 2 monoclonal antibody there. It's critical. It's being given in the first few days after you start getting the symptoms there. It is effective in keeping you outside the hospital. It is not effective while you have been admitted. So if you do think you've been exposed and somebody told you that they test positive and you were there a certain time period where you really think you're at risk, you should, you start looking into it. FDA has just approved this as a prophylactic medication. And so since it's very broad definition, anybody over 65 with a body mass index over 25, which is half the country, sorry, I had to joke, you should get access to it. It has to be used within the first 10 days after the symptoms. It's a single infusion or an injection. So very often it's in infusion centers that you have to be there for a few hours. And there's another one, the first one is full approval by the FDA. There's a new one called Sotrovimab, which is made by GlaxoSmithKline, which is under emergency authorization. So you're probably going to get more of that. But be aware that there's a short window there. If you do think you're at risk, proactively make sure you demand it. And then don't get ivermectin. I have to love the FDA at times. They basically tweeted, "You are not a horse. Do not use ivermectin." And what happened is that ivermectin is a drug that's being approved only for use for cows and horses. And you can see the amount of prescription have absolutely exploded by a factor of 10x in the last few months. It's being used quite a bit in South America. And then what happened is that if you don't use the right doses, you could be at risk of some serious risk. Least one is rash, but you could end up with coma and seizures and all of that. In Mississippi, because there's this huge surge in Mississippi that we saw, 70% of the poison control centers because people took ivermectin and they probably overdosed themselves there, and then they have to be admitted and treated for it. The big paper that created this hoopla about why ivermectin was a good potential drugs after you've been infected has just been withdrawn. And that's usually a very bright sign. It has been withdrawn for what's called ethical concerns, where there was widespread flaws in the data, in the way it was collected and the way it was analyzed. It was the most quoted preprint study showing that ivermectin had a huge impact in decreasing COVID deaths. So we have another hydroxychloroquine problem here. So please be aware, the product is not approved in the US and is extremely controversial right now. Sorry, just lost my thing. So quick update on long COVID. Several data just came out in the last few days. The biggest one is a study from Wuhan where they follow people for 1 year. They show that 49% of people still had problem after 1 year. The biggest one is chronic fatigue and muscle weakness. Another one from eClinical Medicine showing that after 6 months, 98% people had fatigue. And so the point here is that this is not just a Russian roulette about are you going to die or not, and it's a low probability of dying. You have a very high probability of 10 to 30% of developing long COVID. And the data, as we're collecting this time, is showing that unfortunately this long COVID can last over 12 months. Another one did a massive analysis, it was called a meta-analysis of 27 papers, again showing that after 6 months, this is very similar to what happened to the first cousin of SARS, which is the SARS of 2003 and MERS, which was another version there showing that a lot of people develop long-term problems that unfortunately stay as long-term problems there. So this is something that is real and is really one of the other reasons why you should encourage people to get vaccinated. And the brand new thing that just came out today was news to me is that it also seems to have an impact in the back of the cornea in the eye. And they're starting to see some damage there. So there could be not only the short-term problem, but also long-term issues with the eyesight. So a quick reminder, the data is now coming more and more that there's an inflammation imbalance that seems to be into a self-reinforced pathological loop. And that's what's creating this long COVID for months, where these people have this inflammation that creates a response by the immune system after the virus is gone, and then create these chronic inflammations that creates all these hundreds of symptoms that we talked about. Now, the good news, if you were vaccinated, the probability just came out from Israel that your probability of developing long COVID is 0.5%. So it is a very low probability if you're vaccinated. And that's because you take the probability of getting breakthrough case, which is around 2.6%. And this seems to have shown that 19% of this breakthrough develop long COVID. So it is still a low probability, but it is a serious probability for people unvaccinated. So, and for kids, it does show that they can develop long COVID, but again, it's a low probability. And that's a study came out of the UK on 258,000 kids there. So that's a very good data set, but they can develop the same type of symptoms. So what are the safe things to do with Delta? And this was a survey done by a whole bunch of infection control specialists there. And you can see in red what they don't recommend you to do, i.e. go to a big event with a lot of people around you. And what are the things that they think you should wear a mask and be cautious there. So I'll let you take a quick look at there, but going to a movie theater is still not something they will do. Go indoor in the restaurants there with poor ventilation is also a risk. So what about indoor dining? You need to use common sense and look about what is your community transmission rate. I will post this link that gives you at the county level. Unfortunately, right now with Delta exploding there, most of the country is into a high risk transmission level there. And then a friend of mine developed this really cool model there where you can decide to say, okay, what's my COVID case? So in this case, I put like the high COVID case of Florida, Louisiana, and Mississippi there, which is around 110 cases per 100,000. So you can adjust this. And where 40% of the population is vaccinated. And then that basically says I'm exposed for 60 minutes. I'm into indoor restaurants there and people are talking, so therefore they don't wear a mask nearby. And you can see that based on these models, based on the latest data published there, that you have a 50% chance of being infected with a Delta Compare this to alpha, it's 50 times more. So that's the difference. Alpha was not really that contagious. It is like a less than a 1% chance. And this damn delta there is so contagious. It doesn't take much to get infected there. And then your hospitalization risk is 2.2%. So then I'm going to create the opposite case, which is I'm in California, which has a lower community rate of 30 per 100,000. It's a high percent of the population, around 55% is vaccinated there. And I'm going to go outdoor instead of indoors, but otherwise the rest is the same amount of time. And you can see that if you just are aware of your environment and what you're doing there, that 50% now dropped to 0.74%. So it's still a manageable risk there. And so I will put that link there. You can just play with it. It's kind of an eye opener that if you go to an indoor restaurant on a regular basis there with poor ventilation there, you're really getting yourself at risk. If you decide to travel within the US, I would also post this link, which shows the vulnerability by county. Of course, right now, as I said, it's not a really great time to travel, but you can take a look. You can see some part in the middle of the country there that seems to have a low incidence. It gives you an idea of the amount of risk in the community there, depending where you are. And then if you're unvaccinated, the costs are now going up. As Pfizer got full FDA approval there, you see more and more employers forcing different rules. And so the first one that happened in the last few months is that the healthcare insurance company are no longer providing free of cost testing and treatment for the cost. So suddenly all this high deductible plan there are going to kick in. And all you co-deductible and all you co-pay, all of that are now coming back and you have to pay for that. And that could be as high as $2,200 for small firms. And a lot of the high deductible plan can be as high as $6,000. And that will be very easy to do if you end up being hospitalized. The other thing is the employers now are starting to look at raising the insurance premium. So Delta, the airlines, is now charging an extra $200 per month for unvaccinated employees for covering the extra healthcare insurance costs that they have. And so you're going to see also that, fine, we cannot force you to get vaccinated, but that means you're at risk of paying a higher share of the medical cost that may happen if you get sick. So, and then unfortunately, we have to talk about the healthcare workers who are literally exhausted. A quote from a nurse there: "You're watching the same house burn down time and time again." And you see a lot of distress from the healthcare workers who are totally overwhelmed. They're quitting. We're having a massive increase in the shortage of the nurses, including doctors who are literally walking out. And so keep in mind, 1,200 nurses have died by providing care in a hospital setting. And as a result of that, because probably 25% of the hospitals in the country there, especially in the Southeast, are overwhelmed, you're at risk. If you get a heart attack or a car accident, they cannot give you the care that you used to have because they don't have beds or they don't have the personnel to take care of you. And basically the line in healthcare, when people are understaffed and overwhelmed, people die, not necessarily COVID people, but everybody else who needs healthcare support. So time is running out. Please help your friends or yourself get vaccinated. And there's so much information happening there. Last 5 weeks, there's been so much information there. I may do another one before the end of September. So please, sign up on YouTube to subscribe so you can get notification if we do another one before now at the end of September. Stay healthy and enjoy the end of the summer.